It's been almost a year since we first needed to limit visitors to long-term care facilities. Since then, we've made great progress in our fight against COVID-19. Our hospitalizations are now down 83% since January, and number of cases are at the lowest levels that they've been since last summer. And I'm pleased to report that all residents and staff of long-term care facilities now have had the option to be vaccinated. Because of that progress, now is the time to reunite Oklahoma families and let them visit their loved ones safely. Because isolation and depression are very real threats for Oklahomans who have been separated from their loved ones in these facilities for almost a year now. Today, we're updating the state's COVID-19 guidelines for long-term care facilities. I urge all long-term care facilities to follow these plans.
1 year into the pandemic, we know isolation has taken a toll on our nursing home residents, many of whom are suffering long-term impacts to their mental and physical health related to the separation from their loved ones, family caregivers, clergy, and friends. Essential care includes not only physical well-being of residents, but also the mental and emotional well-being. With that in mind, we are updating visitation guidelines to allow for trained essential caregivers to visit their loved ones in long-term care facilities across the state.
We have worked with both care providers and the legislature to ensure that guidance is both doable and meaningful. Because we want the barrier of entry for visitors to be low, we also want to ensure our most vulnerable Oklahomans are safe. Under this new guidance, we are asking that visitors at all long-term care facilities complete state-provided essential caregiver training, and that a resident sign a waiver allowing visitation. We will make this training available online so family members can easily access it and it isn't a barrier to safe visitation. Visitors who complete this training will still need to follow a number of guidelines in order to safely visit their loved ones. These are when both a resident and a visitor are vaccinated, as in this facility, 96% of residents are. A mask is required and proof of vaccination completion may be provided for both to have unsupervised contact. If either the resident or a visitor is not vaccinated, so one or the other, a mask is required and proof of a negative COVID-19 test within 48 hours may be required for access and entry into the facility. Non-supervised contact may occur once those are accomplished. And in situations where neither a resident or a visitor are vaccinated, a mask will be required and proof of a negative COVID-19 test may be required for both to have supervised non-contact visits. This training will be posted online today to ensure families can enhance their visitation as soon as possible. This should take caregivers no more than 15 minutes to complete. We also know many of our facilities are governed by Federal Centers for Medicare and Medicaid Service directives. This guidance is supplementary to federal mandates and does not conflict with federal guidance in any way.
I want to stress that facilities will need time to implement this enhanced visitation policy. So I just ask the public to be patient as facilities navigate through this new guidance. It's not going to happen overnight. We would like for facilities to have policies and procedures in place to have this implemented by the end of next week.
So all they have to do is someone says, I want to come in, I want to see my loved one, I want to be deemed an essential caregiver. They go through this very short, brief kind of review of information, and then they are deemed an essential caregiver.
It is highly probable that visitation in long-term care facilities will not look anything like it was pre-COVID at any time in the near future. The expectations that visitors wear a mask to be respectful of not only their loved one, but others in the building who may not have had vaccination, that is going to be something that will be in place. We should remember that there are new admits into these buildings at all time. Those new admits may have not had the opportunity to have had a vaccination. So through this training, it's essential that we, number one, set the normal, that there is going to be an enhanced safety protocol for visitors to long-term care, and we need them to understand the importance of those infection control and mitigation techniques.